Good morning. Today we're diving into an updated systematic review that examines something we often take for granted in medicine. We're talking about the latest review on what patients' perceptions of physician attire is, a topic that directly influences trust, professionalism, and the patient-physician relationship. This new update shows that attire matters, but the best choice depends on gender, clinical environment, medical specialty, and even the COVID-19 pandemic era. For male physicians, patients consistently perceive them as more professional, trustworthy, and confident when wearing a white coat or formal attire. A suit plus a white coat is often seen as the gold standard. For female physicians, perceptions were more complicated. Patients did trust women in white coats, but at times female doctors were misidentified as nurses or other staff, showing ongoing gender bias. Casual attire was generally viewed negatively for women physicians. The takeaway? White coats boost professionalism across genders, but biases still affect perception. Environment plays a huge role. In primary care, patients accepted casual clothing, but usually combined with a white coat to maintain that ever so necessary credibility. In emergency and hospital settings, patients strongly preferred scrubs or white coats, linking them to hygiene, authority, and readiness in urgent care situations. So, the attire that works in one setting may not be effective in another. Preferences also varied by specialty. In dermatology and neurosurgery, patients strongly favored formal attire and white coats. In internal medicine and anesthesiology, scrubs plus a white coat were preferred. In family medicine, casual clothing had a surprisingly positive impact, especially for male patients. This highlights that attire is not a one-size-fits-all. Specialty context shapes patients' expectations. The COVID-19 pandemic shifted perceptions dramatically. Patients valued scrubs, masks, and PPE as symbols of safety and infection control. Interestingly, formal attire lost some importance during this time, as hygiene and practicality became the priority. Now, compared to prior major review by Petrelli and colleagues, this updated analysis adds specialty-specific preferences, gender differences in perceptions, post-COVID shifts towards scrubs and protective equipment. Most of the studies included were from the United States, so preferences may not fully reflect global cultural differences. Many relied on self-reported data, which may not capture actual patient behavior. Ultimately, physician attire is more than clothing. It's a key factor in building trust, strengthening communication, and enhancing patient care. Hey, struggling with frequent bathroom trips, urgency, or bladder leaks? You're not alone, and help is here. Join me tomorrow at 9 a.m. on UroNurse as Etna Dabrowski, an expert in pelvic health solutions, coming to us all the way from Copenhagen, Denmark, explores how digital tools and easy-to-use software can transform your bladder health. Well, that wraps it up for today's episode of UroNurse News. For more updates on the latest research in urology and patient care, don't forget to like, subscribe, and share. And thanks for watching, and we'll see you next week. Hey, by the way, all week long at the end of the episodes, I've had that cowboy kidney dancing along and playing a song. If you want, put something in the comments about whether you like the dancing kidney or the song, or if you just don't like any of it. Hey, always good to hear from everybody.
UroNurse News, your daily guide. Healthcare stories we bring worldwide. Tips and updates straight to you. UroNurse News, keeping care in view.